preparing to share loved ones. But for some folks, these foods could trigger indigestion, and they could be a real problem for people suffering chronic digestive issues. Joining me now to talk about one such condition is gastroenterologist Dr. Raj. Hi, Dr. Raj. Good morning.
Good morning. Happy to be here and talk about the holidays.
We're happy you're here too, and you want to highlight a condition called EPI. Now, what does EPI stand for, and what is it exactly?
Sure. EPI stands for exocrine pancreatic insufficiency, and this is a condition where your pancreas is not producing sufficient amounts of digestive enzymes. These are the enzymes we need to digest our food properly. So if you're not digesting properly, you may experience uncomfortable symptoms like abdominal pain, gas and bloating, diarrhea, and sometimes even weight loss. So it's something you really want to investigate because it is treatable. And if you think about it, these are symptoms that many of us could experience occasionally from time to time if we maybe have a very rich meal or eat something we shouldn't have. But if it's happening frequently or persistently, it's something you want to talk to your doctor about because it could be a sign of EPI or even another GI condition. And there's a website, identifyepi.com, that talks more about these symptoms. But in general, you don't want to ignore them. You want to address them.
And who are people most at risk? Who are the people that are at risk of having this condition?
Well, because this is a condition of your pancreas not working properly, if you have an underlying pancreatic disorder, something like chronic pancreatitis, for example, where your pancreas is inflamed, or cystic fibrosis, or even pancreatic cancer can be associated with this condition, anything that affects your pancreas could put you more at risk for EPI.
Now, what steps can people take around this time of year, around the holidays, for better control of their digestive health?
Well, I think control is a great word because many of us feel somewhat out of control when we go to these holiday parties or these, heavy dinners or meals that we're served. So one thing you can do is proactively plan ahead, talk to your host or hostess before the event, not the day of, and express any special dietary restrictions or needs that you may have. And you could also offer to bring your own dish or two, something that you know you'll be able to eat comfortably and still enjoy. I think it's also important in terms of planning ahead, get a good solid base of food in your stomach before you go to an event or a party, or certainly if there's going to be a buffet table. You want to have something in your stomach. Many people do the opposite. They fast for hours or all day before they go to an evening event because they think that'll let them, eat more later and get more calories in later. But this is not a good idea. If you're starving when you get to a party, you're going to overindulge, overeat, and then feel lousy afterwards.
And Dr. Raj, we're short on time, but is it important to schedule a visit with your doctor before making major changes to your diet?
Very important. Don't cut things out of your diet before talking to your doctor. Gluten, for example, if you cut it out of your diet, then you go to your doctor and they want to test you for celiac disease, the test will be inaccurate if you've cut gluten out on your own. So really see your doctor first and talk to them about what you should be eliminating and when.
And where can we go for more information on all this?
You could go to the website identifyepi.com.
Dr. Raj, thank you so much.